Welcome back to Med School Radio, bringing you the best in medicine. This podcast is for informational purposes only. It is not medical advice. Always consult a qualified healthcare professional for any medical concerns. You know, a lot of people get worried when they start feeling strange heartbeats, especially when it seems like every third beat feels different, like a flutter or a skip or a heavy thump. It's one thing if it happens once in a while, but when it comes in a pattern, it really makes you stop and think, okay, what is going on with my heart? In many cases, what people are actually feeling are early or extra heartbeats, things like PACs or PVCs. And when they show up every third beat, there's a medical name for that rhythm called trigeminy. And sure, the word sounds pretty intense, but the feeling of it is usually far more dramatic than the danger of it, especially if the heart has already been checked by a cardiologist. So if someone has already gone through the usual heart testing, things like EKG, a Holter monitor, an echocardiogram, maybe blood work, maybe a stress test, and after all of that, they were told their heart is structurally normal, then in many cases, these rhythm quirks are considered harmless. I know that can be annoying, distracting, or even scary, but a lot of people with completely normal hearts have these extra beats for years with no long-term harm at all. That said, just because something might be considered benign doesn't mean it should be dismissed, and it definitely doesn't mean the experience isn't real. It's always worth paying attention to how the symptoms feel over time. If they suddenly become more frequent, if they start interfering with daily life, or if they begin showing up with other symptoms like dizziness, fainting, shortness of breath, or chest discomfort, then it's definitely worth checking out with a doctor again, just to be careful, just to be safe. And if there's a strong family history of rhythm issues or sudden cardiac problems, that's another valid reason to stay on top of it. Something else that's interesting is how much these rhythm sensations can be influenced by everyday things, not dramatic emergency type things, but normal habits, stress, anxiety, dehydration, caffeine, alcohol, poor sleep, stimulant medications, and even big heavy meals. They can all make premature beats more noticeable. So sometimes improving hydration, cutting back a bit on caffeine or alcohol, getting better sleep, or working on stress management can make a bigger difference than people might expect. Now, one of the big questions people ask is, okay, but is there a way to actually fix this? And the short answer is yes. There is a medical procedure called catheter ablation, and that can sometimes eliminate these premature beats entirely, but it's not a one-size-fits-all solution, and it's not something doctors rush into. Ablation is usually considered when the extra beats are definitely coming from one specific, easily identifiable electrical spot inside the heart when the person is really struggling with symptoms or hasn't found relief through lifestyle adjustments or medication. It's also taken more seriously when someone has a very high number of premature beats, because in that situation over time, it can start affecting how the heart pumps. When all of those pieces line up, ablation can be incredibly successful, sometimes in the 70 to 90% success range, depending on where these beats are coming from. But because it's still a procedure involving catheters inside the heart, it carries risks like any other medical intervention. So it's usually reserved for cases where the potential benefits clearly outweigh the downsides. So here's the main takeaway. Feeling a strange heartbeat every third beat can definitely get your attention, and it makes total sense to want answers. But if a cardiologist has already done a thorough evaluation and confirmed that the heart is healthy, strong, and structurally normal, these sensations are often just an electrical quirk rather than a danger signal. Some people learn to ignore it, some people find relief with lifestyle adjustments, and some, in certain situations, go on to discuss ablation with a heart rhythm specialist, and that's completely valid too. The most important thing is paying attention to your body, noticing changes, and feeling comfortable asking questions. You don't have to panic, but you also don't have to pretend it isn't happening. You're allowed to care about how you feel.